Edutainment Studios welcomes you to Non-Small Cell Lung Cancer Treatment Guide. This module is part 1 of a 6-part series intended to help you understand non-small cell lung cancer. Most people who have lung cancer have non-small cell lung cancer, or NSCLC. Although it's serious, treatment can sometimes stop it from getting worse. There are things that you can do to help yourself feel better. If you smoke or breathe a lot of smoke, you are most likely to get NSCLC. Non-small cell lung cancer accounts for about 85% of all lung cancers. It develops in the cells lining the bronchioles, which are small branches off of the trachea, and the alveoli, which are tiny air sacs at the end of the bronchioles. In this course, the objective is to help you define the basic information about non-small cell lung cancer. The lungs are 2 spongy organs located in the chest. The right lung has 3 lobes, and the left lung has 2 lobes. The lungs help the human body to breathe in oxygen, deliver it to the rest of the body, and get rid of carbon dioxide as a waste product. When you breathe in, air flows from your mouth and nose into your lungs through the trachea. From there, air travels into your lungs through 2 small tubes called bronchi. They furthermore branch into smaller tubes called bronchioles. At the end of the bronchioles are alveoli, which are tiny air sacs that fill with air. In the alveoli, blood vessels absorb oxygen from the air and move it into the bloodstream so it can get to the heart and all the cells throughout your body. After cells use the oxygen, the waste returns through the bloodstream to the alveoli, where it is breathed out as carbon dioxide. When cells are healthy, they grow and create new cells as your body needs them. If the DNA of cells in the lung tissue is damaged, the cells become cancerous. If you have lung cancer, the DNA is usually damaged from cigarette smoking. But it can also be inherited from a family member or caused by exposure to radon gas, secondhand smoke, or other chemicals. You have DNA inside of your cells that makes up your genes. It tells the cells how to act and what to do. Usually, when a cell's DNA is damaged, it repairs itself or the cell dies. In cancer, the damaged cells do not die, and they continue making new cancerous cells. These cells can build up and form a tumor. In the lungs, tumors can grow in the cells lining the bronchi, as well as the bronchioles and alveoli. If you are not treated early, lung cancer cells can spread or metastasize to other parts of your body. This can happen when cancer cells grow into nearby tissue or break off from the original lung tumor and get into the bloodstream or lymph vessels. Lymph vessels are like blood vessels, but instead of blood, they carry clear lymph fluid. Cancer cells can spread through the lymph vessels and bloodstream to the lymph nodes. Lung cancer cells can also spread to other organs even before symptoms materialize or have been detected on an X-ray. There are 2 main types of lung cancer. Type 1, also known as non-small cell lung cancer, or NSCLC, starts in epithelial cells that line the parts of the lungs. Type 2, or small cell lung cancer, begins in nerve cells, or hormone-producing cells in the lungs. NSCLC is the most common form of lung cancer, and there are 3 types. Each one is made up of different kinds of cancer cells. Squamous cell, or epidermoid carcinoma, starts in cells that line the airways. It is usually found in the middle of the lung, next to one of the bronchi. Adenocarcinoma starts in the cells that make mucus. It is usually found in the outer parts of the lung and often grows more slowly than other lung cancers. Large cell carcinoma can form in any part of the lung. It tends to grow the most quickly. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 1 of this 6-part series on non-small cell lung cancer. And come back for part 2.